connect with God and ask for His blessings. It is also a way to show our gratitude for all that He has given us. I would like to ask Dr. Jayashree R. Perwaje to the stage for the prayer.
First of all, I welcome Sushruta Ayurveda, who is a well-known physician here in Puttur, to grace the occasion to inaugurate the function.
I like to ask Dr. Jayashree to give a token of love to sir.
We are extremely happy to have Dr. Brahmadatta Nambudri, a traditional Vishwavidya.
I would like to ask Dr. Sanjay to
Welcome him. Wholeheartedly welcome Dr. Mail Vagaili, who came from far away to this function. I welcome him wholeheartedly.
I asked Sushruta to come over and give this token of love.
And I extremely happy to welcome Sandesh Lakshmana for this. I like to welcome Vidya Rishi to this function.
I would like to ask Jay Kumar.
I like to welcome Vidya Shankara Nambudri. Take. I like to welcome Vidya Pradesh, who is a documentation expert. Yeah. Then I welcome Vaidya Prasanna, a medical officer, to this occasion. A Yatra all over India for another 15 days. They are covering almost, I think, 15,000 kilometers for this in this Yatra. Why I am really happy is, see, this Ayur emergency, this word itself is a really perplexing. Why? Because usually we think Ayurveda means only chronic patients, not emergency. How emergency care can be done in Ayurveda? This is a really interesting thing. About 2 months back, Vidya, Dr. Mail Vagaili called me. We are conducting one Yatra, we will come into your center. I was extremely happy because of my own experience. We used to see the patients of especially acute stroke, because stroke means the patient comes first to Ayurveda. whether there is any treatment. If you don't give treatment, they go for allopathy. This is what happens usually. We are not able to give specific treatment. That is why we usually refer the case to higher centers. We are thinking that people will not come for emergency care for Ayurveda. Actually, they come for Ayurveda. Since we are not able to give a specific treatment, they go to different other centers. So I had the same experience after opening my hospital. Second day itself, I had a acute case of stroke. Within an hour, he came here. They told, Pakshagata is there, you treat. Usually, I used to refer. Then I thought, by seeing its outcome with the allopathic intervention, can we do some better or very good intervention with the Ayurveda? A patient of unconscious, semi-conscious, they come, how we can treat? I adopted many of Ayurveda interventions. I got succeeded. Many patients I have treated. One day, in about 10 years back, a university vice chancellor and along with one Denmark physician came here. Luckily, on that day, one acute case came here. I have treated that patient in front of them. They are surprised to see with Ayurveda you get such a fast result. How it is possible? Then they got a grant from central government. They had done a study of Ayurveda intervention, how much it is useful. For about 6 months, one investigator was appointed. She was here under a stroke specialist, an American, Indian-born American scientist, stroke scientist. She came here and seen the procedures, then told let us have a study on it. And the investigator is appointed. She was here for about 6 months. They have documented about 10-15 cases. Out of 72 cases they have documented. They have taken for a study about 13 cases of acute only ischemic stroke, not hemorrhagic stroke. And then they have went to CMC Vellore. They studied another 15 cases there. They compared how it was Ayurveda. The main aim was study was is this Ayurveda intervention is safe or not. First thing is safety. If it is not safe that much as allopathy intervention, why we should do? They have done that study. Then cost is not and effectiveness. At the end, the result came and it was published in the government journal. What this one is, it is equally effective and safe, and cost is very less, 1/3 of cost of Western modern allopathic intervention. That's what they have given. And they told to see is it more effective, we have to study more than 100 cases. That is why they have not done that aspect, but it is equally safe. So that experience what I am having. So he told we will come. Now, okay, let us have a discussion, mass discussion. Like that, many Vishwavidyas like Nambudri sir is there, they are having their own interventions. And in different part of India also, many Ayurveda physicians, they have their own experience of critical care medicine in Ayurveda. So these things in this modern time, these are vanishing from our practice. So if we integrate this modern Ayurveda intervention with the modern treatment, if integrated, I think we can have a better result also. If there is some complications, we can have modern interventions. Sometimes what happens when we treat, for example, in acute stroke also, when we treat, because of disease, patient may get aspiration pneumonia or uncontrolled convulsions. Something after our intervention, also it may not be controlled. Then we need some Western medicine help. With that, if we integrate it, can we have a better result to the society? This is what motto. On this motto itself, they are conducting this yatra. That is why I am happy. So I welcome you all, Vaidyas, all other delegates who come here. Welcome all of you. We have a discussion for whole day on this concept. How we can go forward, how we can have a Ayurveda intervention with the modern allopathic interventions, how we can integrate it safely and effectively with this motto. I am very thankful for all of you to come here. I welcome wholeheartedly. Even press persons also have come to cover our inaugural session. I welcome all of press persons also. With thanking you, I conclude my welcome speech. Thank you.
As you all know, the lamp is a symbol of knowledge, wisdom, and enlightenment. It is also a symbol of hope and optimism. By lighting the lamp, we are signifying our commitment to these values. I ask Dr. Sushruta Ayurveda, well-known physician of Puttur, to light the deepa.
Hello, sir. Hello.
With his presence, I kindly request you, sir, to address the gathering about ICU Emergency Yatra.
Good morning, everyone. Very happy to be here, and I thank everyone from the team to be here with me. It is really teamwork. There is no one leader. Everyone has to lead at his pace. So, to have a word about the ICU Emergency Care Project and the ICU Emergency Yatra. Thank you, Dr. Pervaje, to welcome us. We feel very well here. Thank you. The ICU Emergency Care Project started in 2017 under Krishna Kumarji and during Tata Prakashmi, where I met the first time Dr. Pervaje. It is a place where some vision, ideas can touch us. So from this time, Dr. late Padma Shri Kumarji asked me what you can bring to the Ayurveda community. At that time, I was just in India for less than 1 year, trying to understand what is Ayurveda, trying to disbuild my mind to see, oh, we can see the world and the life differently. And the idea to bridge Ayurveda and emergency was very difficult for me at that time. But years by years, I met different doctors who treat emergency cases successfully. And in 2020, we did a webinar where more than 18 or 19 videos for 4 days speak about critical care emergency in Ayurveda. So at that time, I say, okay, there is a real scope. It is really one big domain in Ayurveda, but unknown. And unknown to me, this I accept, but unknown to most of the Ayurveda community. And this was a little painful at one point. I was thinking, Ayurveda community, most of the time, the youngest, the student, lack of confidence. And most of the time, because they don't feel confident to treat emergency, or this is reserved for multi-speciality hospital. And even to be trained in basic life support or in emergency care and life support, the Ayurveda community struggle to access. and we could observe this during COVID. So at that point I said, okay, we have to create something, we have to go. I discussed with Krishna Kumarji and the team in ABP. So we have to build. So now we found a training, 4 days, only hands-on simulation and on practical, to be able to be in the rescue chain and face the common emergencies. But I think the society is not so prepared to receive this message. So this Yatra is in this way to connect all the university, all the resource person, the great media who treat emergency, so we can document it. We can have them as a pillar and reach Ministry of Health and Ministry of Ayush to propose this to them and say, please support fully and try to help us to develop this in the same time in many states, so it will be safe for this project. This is a little introduction. I think we can talk a little more after the inauguration session. Thank you.
Thank you, sir. Thank you for the idea to spread Ayurvedic treatment all over the world, and for the study and for those who have studied Ayurvedic medicines, to give them confidence to practice Ayurveda treatment and to give common emergencies with the help of resource persons. Thank you, sir. Dr. Suresh Puttur for his presidential talk.
A very good morning to all of you. Dignitaries on the dais and all the doctors who have gathered here for this wonderful seminar on IU emergency care. I am really delighted to be here. When Dr. Perwaji sir told about this program, I was excited. Even I did not have that concept of this emergency care in Ayurveda. For the first time I heard about it. I am eager to know what it's about, this emergency care, how Ayurveda can also tackle all these emergencies, since I am a physician of modern medicine. As Dr. Perwaji sir told, I have experienced, I have witnessed him treating all emergencies here in his hospital, because even I visit sometime this hospital. It's a great honor to the Sushruta Hospital and to Dr. Perwaji sir, as Emergency Yatra have selected this as a resource place and selected him as a resource person. With this seminar, I feel all of us can have some idea how emergencies can be treated in our day-to-day practice. As Dr. Perwaji sir told, most of the patients come to Ayurveda first, at least in our place. If it is not treated, then only they come to the modern medicine or modern medicine multi-speciality hospitals. So, through these seminars, I think all of us can gather. Even I am interested, I am eager to know how emergencies can be treated in Ayurveda. So, I congratulate the team of Ayurveda Emergency Care and also Sushruta Hospital for conducting this seminar. And I also wish you all the best. May Lord Dhanvantari and Mahalingeshwara may bless you all. Wish you all the success. Thank you.
We are going to end this program for the time being now with vote of thanks from Dr. Samira Krishna Perwaji.
First of all, I would like to thank whole team of Fire Emergency Yatra under the leadership of Dr. L. Logan. Thanks. I would like to thank Dr. Suresh Puttur sir, who has inaugurated the function by lighting the Deepam and deliver wonderful speech. Thank you, sir. I thank Dr. Desha Perwaji for her devotional prayer. Thank you. I thank Dr. Ravishankar Perwaji sir for welcoming each and everybody to this conference. Thank you. Thank thank you each and everyone who has come here and with the gracious presence for today's training session. Thank you everyone.
Objective of this Yatra is to sensitize students and Vedya to the necessity of starting with a common training in emergency. And at the beginning, even for me, it was painful to ask Vedya to learn what we call international guidelines or allopathic guidelines, because emergency now almost everywhere in the world is handled by allopathy medicine. So if we want to communicate and develop Ayurveda management, I think we need to reach this foundation, the rescue chain of India. And the rescue chain of India, it's handled by allopathy. So how to do it in an efficient way, 4 days, and which training, how to reach rescue chain, then to develop the management. This is the first point. The second point is developing a blueprint model for the research ecosystem in Ayurveda integrated emergency care. How we can implement the training and the knowledge on emergency and Ayurveda in a scientific way. Means scientific, it's very large, but where the society can understand, okay, I understand the logic, and every scientist has a lot of difficulty to say, no, it is not true, it is not logic. In this way, we need to develop an ecosystem following the roots of Ayurveda, the Shastras, and the epidemiology, the epistemology, of Ayurveda, to be confident to do the research in Ayurveda. The third point is connecting experts to create a cooperative network to face new challenges. Because I say just before, I don't want to see another time this injustice saying, oh, you are Ayurvedic doctor, you cannot treat this case. This is not fair. And we observe after maybe many cases was better treated by Ayurveda communities than by my previous community. So these 3 points for the Yatra. Now I will come back to the IU Emergency Care Project. So it was initiated by Krishna Kumarji, and he facilitated a lot my stay in India at the beginning. Now we are settled with my wife and my son. And this text was brought by Dr. Rishi, who was very close to him. It is the time for Ayurveda community of physicians, scientists, entrepreneurs to take forward the mission of the selfless Padma Shri P.R. Krishna Kumar and help carry forward this great mission on behalf of the collective Ayurvedic community. Beyond borders, uniting the wisdom. So I think it is more a movement than a project. And it is more a platform. We need a platform open to every Vedya, every doctor, every scientist who feel, oh, there is something to do in this subject. So these 3 points we try to do in the Yatra, almost to follow these 3 directions. IU emergency training, we have to build this. It will take months and years, depend how many we will be. Translational research, how to apply directly what we research. And cooperative management. So today we have a full day focusing more on the translational research. Because the experience of Dr. Parvaji, it's immense. What to bring and what to share with allopathic community in a safe way for everyone. And tomorrow we will have a meeting with KMC Manipal. So it will be challenging for us because we are young We have some experience. We have a great master with us. So if we can bring experience from different great Vedyas, we'll feel more confident. We will have more pillars on our foundation. So the rescue chain. It is clear what is the rescue chain in a country for everyone. Rescue chain is the doctor who can act in the first line. So most of the time WHO say, oh, they count number of doctors and they say, oh, so many for 1,000 people. If it's for less than 1,000, it is, oh, developed country. If it's more than 1,000, oh, they have to improve. And what they do in India, they count only MBBS doctor for full India. And we know in the remote area who are the majority of the doctors, Ayurveda doctor. So the GP, MBBS in the city, they are safe and they don't learn much emergency management. And the Ayurveda doctor in the rural area struggle because they are in PHC with allopathy drugs and BMS. So this has to be changed. And I hope soon, if majority of the Vedya are trained with certified training in international guidelines, we can show you have a better level than GP allopathic doctor. Because you practice, because you have a very upgrade training, certified, and you are motivated. So as a rescue chain, you can lead. Because in the rescue chain, the emergency doctor, how many in the country? Very few. Emergency management, emergency specialty in India starts in 2008 or 9. Very few emergency doctors, and most of the time they stay in the department. So they see specific emergencies already stabilized, already not the first line. So this is the goal, to reach this ground of rescue chain and to feel, oh, I have the same knowledge as MBBS doctor to face common emergencies. If we can include this in the BMS final year, 4 days, I think it will change something in the confidence of the Vedya and for the society. You can change. So this training, it was at the beginning only for MBBS. But I meet the CEO of the trust Jivaraksha in Bangalore, and he's from Kerala. He was 15 years in UK, in trauma center, and he's really open to include all doctors. For him, a doctor is a doctor. Yeah. So he can act. Emergency situation management, the first steps are very, very simple. Most of the time, A, B, C, D, E, finish. So he's ready, and we work together. We have worked together to see what we can do with this training for MBBS. And in fact, we decide to change nothing, almost nothing. The only thing, we took the book, the syllabus, and we just color in yellow the allopathic drug management, only 20% of the book. And we say, depending on the law in the state, you can directly practice this because it's a vital emergency, or you need to call a referent in emergency department or write an agreement because he knows you and you are certified. Arrangement like this. So this will be case by case or state by state, and this will be a work from lawyer. And this training 4 days only practical. So the goal is not to be ready after 4 days. The goal is to complete this training with the training of trainers. So you do 4 days, you are provider. You know the basic of emergencies management in international guideline. Then, directly or after 1 month, you do the TOT. It is 1 day preparation of pedagogy, how to interact with the students. Then 5 days of training. In fact, a new batch come and you are trainer directly, supervised by senior trainers. So it's a chain and you don't lose time. And if you do this, already you know the syllabus and the management 2 times. 1 time you learn, 1 time you teach. Then you do again, 2-3 times, you become expert. You can go. So this is Jiva Raksha. It is linked with Rajiv Gandhi University. And this Yatra, the goal of this Yatra is to be accepted in most of the states of India and be supported by Ayush Ministry. The final goal will be to have this type of training included in BAMS final year. So these are the different emergencies: cardiac, respiratory, trauma, burns, obstetric, neonatal, pediatric, toxicology. With Dr. Kantesh, we think we can add psychiatry emergency. In this time it's necessary. And how to create the AECLS. For now it's AECLS, just to say it's ECLS for Ayurvedic doctors. But we will add Y and U to create the IU ECLS. Taking this syllabus almost as a base, finding the equivalence in Ayurveda reference as diagnose all the terminology in Sanskrit. From this, looking which chikitsa, how to apply it, how it can be practical in the day-to-day life. And to do the TOT, the same model, because even with the previous one, the AECLS, you are independent. After 2-3 cycles of AECLS TOT, you have 20-30 trainer. You can create a training center. The first one can be a regional training center, and after other training center in the state. And you can train your community by yourself. Don't need to call allopathic doctor to do BLS. And you can certify them. You are certified for this. You can. So this is training part. And I really like the way they built it, because it's very cost effective and it is ready to give the autonomy to the trainers. And how I said before, it's biologists, radiologists are included in this from allopathy. So for me, one biologist doctor has less capacity in clinical practice than a Vaidya. So no one can say, oh, why Vaidya are trained in this? If a biologist can be trained, no argument. Okay. So these are a few references from before, I don't know, it was 1 or 2 years before, COVID time. So references are there, but now I'm sure after the Yatra we will have 100, 200 references. Even I search references, I never saw references of Dr. Pervaje on acute stroke. So I don't know how, in which base, even in the Ayurvedic one, in how do you call the platform for references in Ayurveda? AVP launched something like this, I don't remember. But even there, I didn't find these references. So this, we need to document and collect all the references to approach the policymaker, to approach Ministry of Health, to approach other community like allopathy. I don't know if you know about Dr. Ashwat Rao, who treats a lot of cases in ICU in Bangalore. He's a MBBS surgeon from a family from Manipal of Ayurveda lineage, and he had a very good result in oncology, in emergency, in even pulmonary failure, cardiac failure. So he's with us today. He cannot be there, but he's part of the team. So for me, it's one of the MBBS doctor who practice more Ayurveda in ICU because he has access directly. So this is the way a little, but it can be changed. This the first step. The second step, implementing with Ayurveda knowledge and practice and experts. And this is the Yatra. Documentation, asking more support, publishing, helping to publish, and to build a strong network. Then building the Ayurveda reference and starting the cooperation or the standalone. Why not? But this is a big limitation. This is a very big limitation. Most of the MBBS doctor and the Ayurvedic doctor look the West. Oh, I will do my PG in UK, in US, or more value. And the brain start to say, oh, Indian knowledge, past. It's finished. I don't need Sanskrit. Why Sanskrit? Why do you learn Sanskrit? What use? This is very problematic to rise Indian knowledge. And I think everyone in Ayurveda needs to be expert in Indian knowledge because it's the foundation. If you want to explain what is written or the logic, how they build the Ayurvedic text or methodology, you need to go deep in the science of Ayurveda. Not learning how to write and publish an article in the Western manner. I don't know if in PG you learn this, not sure. I think you just look what is PubMed and how to do like them. But I think we need to create our own methodology. And for this we have to work on what is my belief, how I value, what has more importance, to publish in Lancet or to create a new way of doing research. I think you know everyone, Dr. Ramanohar. It was in a team and they create the black box model. I don't know if you know about black box model. So this afternoon we have to talk about this because they were facing a limitation doing the study and they find a solution to have the same level of value of recognition, creating a model from Ayurveda for traditional medicine. This I think it happens if we authorize ourselves to do it. If we say, oh no, it is not in the recommendation, I cannot do, it is not there, or we cannot do. This is the limitation. Okay. So this will be for this afternoon one subject, and we can talk on it this afternoon. I think I can stop here. And it is how to cooperate, and for this what we need to develop before cooperation. The challenge is cooperation is tomorrow in Manipal, so we have this afternoon to work on it and find solution. Thank you.
Will be Dr. Skandesh.
Thank you. Thank you, Dr. Mail, for wonderful presentation of the project IU emergency. So the major component of IU emergency can be considered as IU emergency Yatra, so which we can see, which we are now being engaged in this prestigious institution. So every system, medical system, is being dynamic when considering its application in the emergency care. That makes a system to be more dynamic in terms of its capability in handling emergency care. So to have and engage with that context of its assessment or any kind of application in the future, how it can be incorporated, there must be a process which is also dynamic. So it should not be like a process which actually sticks somewhere and cannot move out and kind of a rigid structure. But the process also should be dynamic enough so that the dynamic procedure itself can capture what is happening in a Ayurveda emergency. So that actually conceptualize the process of like a Yatra. So Yatra is a dynamic process where we travels into many places. There will be constant engagements and new learnings. So the new learnings which is important is that throughout your journey. Yesterday we had a first workshop. So we had many insight from that. So that makes me to reflect some more things today. So that procedural dynamics itself has giving some insights how we can actually bring these things, put it into the place, and how we can actually make this yatra more meaningful. And that also gives more space to how to engage meaningful kind of participation with all stakeholders who is going to be collaborated with. So to say that the conceptualization of this dynamic process itself transformed into the concept of Yatra that we can see. So Ayur Emergency Yatra we can break into major three objectives. One is to sensitize regarding the relevance of AECLS. So Mail Ji was mentioning about emergency care and life support. So I think emergency care and life support still not access to Ayurveda professionals. Only biomedical doctors are only access to these kind of modules and training. So what we are trying to see is that first, how to actually sensitize the Ayurveda professionals in order to undergo for a standard ECLS training. So that will enable the Ayurveda community to access this kind of very important knowledge, competence, and in order to get into a network where these things are very important in order to proceed forward. So in that way, to sensitize and to disseminate the relevance of such kind of a rigorous standard training in emergency care is very important. That's we consider as our primary objective as part of this yatra. And the second objective is, I think I'm fascinated to see the publication. I was just reading that paper which you have mentioned. So, but what is important is how many Ayurveda academies know that there is a publication over Ayurveda whole system is being independently evaluated for its capability in handling acute emergency. Unless people go and really search on PubMed or something, people will not be aware of that. So, how to actually develop such kind of sharing of knowledge, ecosystem of research, how to build new methodologies that he was telling. We have to go beyond of what is existing in methodological reductionist way of randomized control trial and all. So how to transfers into that kind of an ecosystem where everybody can unite and everybody can share and everybody can take benefit. So two things are important. Everybody needs to distribute their benefit and responsibility equally. That's very important. So in that way we have to create an ecosystem of research and sharing and the documentation also. And third thing, connecting experts to create. So when our team itself, we have an extended team, not just physically we are traveling, we also have active participants and experts who are then online with engaging with the Yatra always. We have people from WHO is working in WHO as public health. Nanoscientist scholars are there who is actually into assess the safety profiles and action of herbominerals in multiple pathways and all. And we have multidisciplinary like my guru Brahmadattanji is actually a traditional, comes from a very rigorous background of Ayurveda learning and application and all, even in emergency care, and Ayurveda physicians, and Dr. Rishi who is actually trying to incorporate biophysics and try to unite Ayurveda and Siddha. So the group actually provides a much more meaning because it's a diversity of group. It is not just the demand of Ayurveda professionals, but it is a demand of the science and humanity that need to be get benefited. So that's what we are going to propose. So actually, as Dr. Ashwath, we have also a very eminent oncologist. He was there with us yesterday. So he is also collaborating with our all initiative. So we have a very kind of rich, diversified team which is actually there. So this is like our team. We can see. Next. So history, I think Mailji has mentioned his milestone and all, how it got the origin and everything. So yeah, the specific with the Yatra will be 7 states, and these are the major institutions we can see. So we are actually connecting with not only the academical institutions but very prestigious clinics, hospitals like this also. So to make sure that there is a collaboration between private colleges, independent Vaidyas, hospitals, clinic, and even industry also, we are trying to collaborate with them how we can make a visit to their place and all. So we are trying to make that there is a diversity of active participation with the Ayurveda community, and also some of the research center which is integrated research is also happening. We are planning to have a kind of a visit in AIIMS also. So that's what our idea is all about. So, and the objectives, as I mentioned, these are our major objectives: how to collaborate, how to make the network. So what is another important is science grows not only with the knowledge but also with the establishment that we are going to create. So if you are seeing the modern medicine doctor staying in India or South India, he does not need anything to contribute into the modern medicine to nourish it, because they are having a network, globalized network, which is grown internationally from many reasons, even from the history of colonization, globalization. Even World War II has contributed into major drugs and discoveries. But for an Ayurveda doctor, it's a responsibility of more, because in India the contribution of an Ayurveda doctor is essential in order to take it into international recognition. So we carrying more kind of responsibility, more kind of the responsibility of more comparing to a biomedical doctor who is practicing in India. So to bring a network as part of a strong establishment is very important. So we have to make understand the need to build a strong establishment with these kind of ecosystems and all. So these are that I was mentioning, and so the long-term objective actually of Yatra actually to come up with data which we can use for the research. We are actually conducting some survey studies along with that, and we are conducting some in-depth interview with scholars whom we are engaging with, and also we are trying to see the perception of actually Ayurveda community, how they are perceiving. Like one of the important question that we try to ask is, what is the perception of Ayurveda scholars regarding to build a competency for the Ayurveda community to face the next pandemic or next emergency crisis that's going to come. So that we are trying to accumulate the data from different kind of places, different scholars, and to see how we can compile it and make as a policy draft also. So that is also one of our objective, how to incorporate this data into the policy guidelines and all, and to how to take this research further ahead in a different multiple kind of link with ecosystems. So this is what the overview of IU Emergency Yatra. So as we propose breaking the boundaries, uniting the wisdom, so we expect all your cooperation and collaboration for the success mission. Thank you, Dr. Parvajaji and the Sushruta family to host this and to have an active engagement with the Yatra wholeheartedly. I'm thanking on behalf of IU Emergency team. Thank you.
If you want more information, you can go to the website ICU India. It can be good if you register, because we will have your contact and we will take you in a Telegram group so you can follow up some information. And there is a mail, iuemergency@gmail.com. You can contact us anytime, and some social media.